As we return now, yours truly, Dolphy Gilpin here in Decatur, Georgia, United States of America, and we are continuing with our CME, continuing medical engineering applications, and in particular with the Amz5x12MIPCA pharmacochemical derivatives. And to continue, we have now erythromycin. This was also one of their pharmacochemical that was researched back there in the 1996 Specialized Medical Research, 4 Madison Street at the time. That was where the research was done, or the resident medical research. And here we have now, if we have ERY as an abbreviated 5x12 3-letter abbreviation, ERY and R. Same pattern as the 5x12, and that's erythromycin. Or it could have been EYN. And once again, note that it's not necessarily the abbreviation that would be used by the companies in their brand name and their generic name to represent the pharmacochemical or the drug. So erythromycin now C37H69NO13 has a molecular weight of 733.93 grams per molecules. And this is the structure here of the erythromycin, consisting a lot of oxygen and hydroxyl group and nitrogen group here. Good look, a lot of double band oxygen and hydroxyl and that. So those of you who are specialized in the chemical aspect of it can look at more detail at the structure of erythromycin. Now, erythromycin is the macrolide family of antibiotics and works by decreasing bacterial protein production. It was first isolated in 1952 from the bacterial Saccharopolyspore and Saccharopolyspore erythrea, and it is used now to treat bacterial infections such as in respiratory tract infection, bronchitis, pneumonia, Legionnaire's disease, pertussis, which is whooping cough, diphtheria, and is used in patients allergic to penicillin. So yes, so this is in one case in which when a patient is allergic to penicillin now, we use the antibiotic erythromycin. It's also used in ophthalmic cases as erythromycin ophthalmic, the preparation used to treat eye disease, using neonatal to treat neonatal conjunctivitis, and in ophthalmia neonatal. So those are briefly some of the application of the drug erythromycin, an antibiotic of the macrolide family, and works by decreasing bacterial protein production. And you have now another antibiotics, tetracycline, C22H24N2O2, and we have just sort of fused the erythromycin application. Should have been stopped here at a tetracycline here with the abbreviation TLE, C22H24N2O2, and it's worked by inhibiting protein synthesis and is used to treat a number of infections, including acne, cholera, plaque, malaria, syphilis, brucellosis, and other diseases. And this is the structural formula now of the tetracycline, consisting of a lot of benzene ring, so methyl group, CH3, HEC, NCH3, OH, amide, hydroxyl, double bonded oxygen, and that. As we said now, this tetracycline using neonates to treat neonatal conjunctivitis and in ophthalmia neonatarium. So we should have stopped here at the erythromycin with the penicillin. It is used for allergic when substituted when patients are allergic to penicillin. The erythromycin is used. All right, so that's or abbreviated Amz5x12M abbreviation would have been could have been TLN, tetracycline, or TLE for the tetracycline. Note that the 5x12 matrix, which is in our imaginative intellect at the moment, when we use this sort of abbreviation here, same thing, and this has been now 8 digits here, represented by these dash, 1, 2, 3, 4, 5, 6, 7, 8, 1, 2, 3, 4, 5, 6, 7, 8, and it takes the same format, the ERY and the RA, the central one, or the EYN, if any of these was chosen for the representation in the 5x12. And we have a precision of 8 digits, precision here, whereas in normal life, our precision is not really to that degree of precision. We take it to about 3 digits. For example, if ERI was dispensed with 250 milligrams, then we have your 250,000,000. But in actual fact, it could be 250,9765430. The decimal point is just left off in precision, and we have kept the 250. I could have been 249.99374567 to 8 figures, but like I said, that degree of precision is not really necessary for these pharmacochemicals at the moment. When you come to nuclear and radioactive application, then more precision would be necessary to prevent toxicology, to our toxic infiltration to the body. Radioactive amounts, you have to be more precise, or nuclear chemical amounts. You have to be more precise, as these only require a small amount to be detrimental to the body. So once again, we'll take a break and we'll come back with more application to the Amz5x12MIPCA in the pharmacochemical consideration.
You got some